All right, real quick, Parkinson's disease. Parkinson's covered it. Minor dopamine acetylcholine. All right. Next one, delirium. All right. Parkinson's disease. Progressively debilitating disease that grossly affects motor function. So again, your nerves, right? Motor function. It is characterized by 4 primary findings, and you must know these. Tremors, muscle rigidity, like stiffness, right? Bradykinesia, which means that their movement is like slowed, and postural instability. These findings occur due to overstimulation of the basal ganglia by acetylcholine. So, too much stimulation from acetylcholine. However, the secretion of dopamine and acetylcholine in the body produce inhibitory and excitatory effects on the muscles respectively. So they help control this muscle function by either stopping or exciting, right, the muscle. However, the overstimulation of the basal ganglia, right, by acetylcholine, because you have too much, occurs because of this, the degeneration of the substantia nigra results in decreased dopamine production. So in short, I'm going to draw it to you like this. Acetylcholine stimulates the basal ganglia because you have too much acetylcholine. This happens though because as you lost substantia nigra, a cause of this leads to less dopamine. And without the dopamine to level out the acetylcholine is having more effect. So what's happening here, a lot of people say, well, you have too much stimulation or too much acetylcholine. But the problem is not that. The problem results in, the only reason why you have so much acetylcholine is because you lost dopamine and it doesn't now regulate with it. You could think of it like if I gave you a salty and sweet drink, but I removed the saltiness from it. So all you're left with is, so is it sweet because I put more sugar, or is it just because now we lost salt? We lost the salt. Does that make sense? It'll make sense. Dopamine and acetylcholine. So, treatment of PD, we will focus on increasing the amount of dopamine or decreasing the amount of acetylcholine. So remember, in this disorder, by ratio, not necessarily because you have too much, but by ratio, your acetylcholine is high while your dopamine is low. But the real problem is that the dopamine is low. That's why it appears that the acetylcholine is high. Does that make sense? Okay. Risk factors. Onset usually happens to people over 50, mostly males, and it's a genetic and exposure to toxins that usually can cause this. Also, chronic use of antipsychotic medications like first generation, the caloperidol and things like that, they cause what?
EPS.
EPS, pseudo-Parkinsonism. This would have been covered in mental health or your farm with antipsychotics. Okay? So, expected findings. Let's list them down. I'll tell you some of the more important ones. We talked about 4. Bradykinesia or akinesia. Slowed movement. Tremors. Rigidity or muscle, you can add muscle rigidity. And it said instability in posture. And I'll add to this as one of the effects there. We'll put a shuffling gait. Shuffling gait. Okay? See, so look at manifestations. Stoop, or in stable, they'll call it a stoop posture. Stoop is like this, right? So in a stable or a stoop posture, okay? Slow, monotonous speech. With the tremors, they'll also perform this like pill rolling motion. Now pill rolling looks like this. Imagine that they're having a pill in between their fingers and they roll it like this, right? You would be rolling a pill in between your fingers, they do this, or this with 2 fingers. Okay? Muscle rigidity, again, slow movement, and then a mask-like impression, right? Lastly, autonomic findings, things that just happen from the reflex due to this. Drooling, dysarthria, where they're like slurring their speech. Mood swings, and eventually they have trouble performing their ADLs. As it progresses into worse, they decline cognitively. They become slow, right? So, to paint the picture, right, you see the stoop posture is a big one. We put it on there, bradykinesia, pill rolling, tremors. Don't forget the drooling, shuffling gait, unstable, slow monotonous movement, okay? So the full list is there, they're all relevant to it. Now if you notice, if you've been to SNPs or things like that, you can see this, like some of them is because they do have Parkinsonism, you'll see that progress, like again, you see it in older male adults. And you see them walking around. A lot of them tend to, like, again, they stoop a bit, right? And you'll see that sometimes they do pill roll, but they walk like this. You ever seen them? Right? So they can be like this, like they walk around. You never seen them? Yeah. It's like a thing, like as it's progressed. So they stoop posture like that. Eventually the walking rate declines. Some of them use like a cane, so that they walk like that, and then they drag their feet, the shuffling gait. Okay? Yes?
What makes it more likely for a male to have it than a woman?
That I don't know. There's no either notices in it, like with gender. Again, it's the genetics. Laboratory tests. There are no definitive diagnostic procedures. Diagnosis is made based on manifestations and their progression and ruling out of other causes. So there is no diagnostic test, but you do this by ruling out other causes and the disease progression that you're observing. And disease progression. We good? Alright, nursing care. So what are our actions? So far, the biggest focus is you should be able to identify like what's causing it. Which again, very clearly said, low dopamine. And this resulting in an inadequate amount or an excess amount of acetylcholine. But the best thing is low dopamine. Okay? And then the expected findings, which we just listed down. That's the most key factors. Nothing causes it, right? It's just age, genetics. Now, our care for them, and there's no way to like definitive lab for it. It's again based on manifestation. Now, nursing care, administer medications at prescribed times and monitor their effectiveness. Monitor their swallowing ability. Okay, and if they do have anything problematic with it, you put them on aspiration precautions. And you can also suggest that they get evaluated by what? Speech pathologist. If they have these problems or swallowing ability, speech pathologist, and have them on aspiration precautions, which will it'll say it at some point when we go down. So document the client's weight at least weekly, diet intake, and what is aspiration precautions, and list them there, right? But what? Sit up, right? So high Fowlers, chin to chest, small bites, slow down while they're eating. Okay? Maintain the client's mobility for as long as possible. So have them use, right? Have them perform. So help them with their mobility. You can have them do yoga. Give them assistive devices like canes or anything to help them get around. Perform range of motion exercises with them. Pace activities and give them rest. So give them rest periods so that they can continue afterwards. Promote client communication. How do we do that? Okay, facial muscle exercises. Speak slowly. And again, speech pathology. Monitor for mental status and safety, cognitive status, mental status, which relates to their safety. So what are the actual actions we use? Observe for depression. The safe environment is no throw rugs. Use electric razors. And page. Okay, if you need any help, services, right, are support groups, long-term care. You might actually have to go into long-term care. For the family, you'll give respite services. What's that? Okay, it's services that if you're the primary care, like the families, the caregivers, these are services that somebody comes and gives them a break. Helps watch them for a while, so that the family can take a little break at least. Okay. Medications. The first one, levodopa. This is the category is dopaminergics. Okay, levodopa, when taken, will convert to dopamine. Okay, this increases the amounts of dopamine in the basal ganglia. When combined with carbidopa, to decrease peripheral metabolism of levodopa. So carbidopa increases dopamine metabolism, meaning the breakdown, right? So you guys have all heard carbidopa, levodopa, right? So carbidopa is slowing down how fast you get rid of your dopamine. Slows down, increases the metabolism of how fast you use it. So levodopa actually increases the level. It becomes dopamine. So you give them a combination to try to make as much possible as available. Yes? As available as possible. Okay? So, one thing to know is can take months or weeks, right? It can take weeks to months to see improvement. It might have to be adjusted in the beginning for dosaging. And the way you know it needs to be adjusted is you will see the wear off effect, and this is done by when you notice decreased mobility, like you start seeing dyskinesia, slowed movement. Then you know the dosage might need to be adjusted again. Now, sometimes they're also given some type of anticholinergics. Okay, which is benztropine, is the common one. And with anticholinergic, what's the biggest concern? The dryness, right? Dry mouth, constipation, urinary retention. So, that says it there in your book, so highlight it, but add this to it. Remember that then we need to treat that, which means increase fluids, sip water, chew sugarless gum for the mouth dryness, increase fiber, fluids, prevent constipation. The anticholinergics are drying them up. Now they'll also use some type of MAOIs, right? MAOIs, but then they use the MAOB version. These are also kind of used as antidepressants, right? What's the big thing with this? So the ones here are selegiline and rasagiline. Right there in your book. And then the big thing I want to emphasize back to this one is no tyramine. Remember? MAOIs, tyramine, right? What's all this? Aged cheese, anything that's fermented. The fruits are avocado and figs, bananas. Those are the 3 fruits you need to know. And anything that's like aged, fermented, or cured. So this is your salami, pepperoni, any type of like Italian meat, fermented, beer, wine, okay, kombucha, all that stuff. Aged, any cheese. What's the only cheese that's okay? Cottage cheese. Essentially a charcuterie board, yeah. People say all the good stuff. Now the other one that they get you is no smoked fish. High in tyramine. However, I see them always get you because they put that you should eat, it's okay to eat, and people click the damn fish. Fresh fish is okay, smoked fish is not. Yes? No. Okay, now beer, wine, cheese, cured meats, avocados, figs, fried, protein powders, and soy-based products. Protein supplements, I think is what it says. And then it just says soup. It's not specific.
No, you wait.
Yeah. Previous page. We'll go back to the other one in a little bit. So you see, it all comes together. a lot of the medications that we're going over right now for like a lot of this, a lot of the antibiotics, antipsychotics, MAOIs, which are in anti-epileptics, all of these are covered in pharm. So failure to master it then, and now they come up now in your questions in your med surge, you see? So I always tell people, try to maintain, even still now, don't be so like tunnel focused. You need to understand the concept, because you're gonna apply it for different things overall. Okay, you guys need grapes.
Grapes?
Cantaloupe, beef, chicken, you can eat fresh salmon, beans, legumes, salads. What do you mean? Y'all just sit around and eat just that?
Bro, the issue is like the security guard, they can't take it to you.
Guys just go around eating cured meats? You do that like once a while. Just sit around eating wine and cheese all day.
No, it's good.
She's like, I do it when
Hey, no, they can work around. They can still make it, take the photos and throw it away.
Last point, and then we'll. Huge break like that, but. Alright, last one. One of the biggest things with them, a complication. So what can result from this? Aspiration pneumonia. As their cognitive and motor function declines, they can aspirate and develop pneumonia. So, as PD advances, chewing, swallowing will worsen. So use swallowing precautions. Again, eat slowly, have a nurse in attendance, okay, to help them eat. Encourage them to eat slow, slowly, chew thoroughly before swallowing. Have them upright. I said this before, but chin to chest. Avoid them hyperflexing their head. Suction nearby, at bedside. Okay, check them for altered level of consciousness, altered cognition. Let them express their feelings. Acknowledge their feelings, express them your feelings as they're declining in life. It's very important. Memory loss, make sure that you validate them, have them share, tell me more. And then of course with this, as they lose urinary function, they develop UTIs, skin breakdown, so turn and change them frequently. Turn, change frequently. And provide skin care. Breakdown.
Oh, you help me Starbucks?
Yes. You want to sign this? I got on Ozempic for $100. $100 an injection.
That's sweet.
It's from Miss Latoya. It's her birthday yesterday. She's the weekend director, clinical director. She does a part-time program. So you guys have never met her. Bye.